What is diabetes mellitus? Diabetes has got two types, diabetes 1, diabetes type 2. So what is diabetes type mellitus type 1? So it when the in it is marked by high blood sugar. The insulin controls how much sugar stays in your blood. The pancreas make the hormone insulin. People who have type 1 diabetes can no longer make this hormone. So that's why their blood sugar it rises and it leads to diabetes. So what are the symptoms? The first symptoms of diabetes they include excess of urination, extreme thirst and hunger, weight loss, more skin and vaginal infections in females. So in children and teens, symptoms may start all of a sudden. A high grade fever and confusion may occur. So it may lead to extreme fatigue and thirst. It is a key to treat the high blood sugar. If you don't, it can lead to serious problems called ketoacidosis. So this is often the first sign of type 1 diabetes in children. It can result in coma or death. If a patient gets ketoacidosis, it is very serious. So insulin is used to treat the type 1 diabetes. So what are the symptoms of type 1 diabetes? It is sweating, trembling of hands, dizziness, hunger, confusion, seizures can be there, loss of consciousness can be there. In long run, high blood sugar can harm the eyes, nerves and kidneys. So whenever a patient gets diabetes, he should get a regular eye checkup. He should get all his kidney functions test done. So kidney diseases from diabetes can lead to kidney failure even. This can cause many symptoms due to buildup of waste products. So people who have diabetes are at a risk of hardening of the arteries. This hardening of arteries can involve the heart, brain, or the arteries supplying the legs. The symptoms may include chest pain, heart attacks, or heart failure. It may lead to even stroke. It may lead to leg pain during exercise that stops quickly with rest. So, in case how to detect diabetes mellitus, we can detect diabetes mellitus by nowadays it is very prevalent HbA1c. HbA1c is an average blood sugar over the past 2 to 3 months, and we can even get the cholesterol or the triglycerides tested. This can help the doctor to assess the heart disease risk, because diabetes mellitus and heart disease risk it goes hand in hand. So and we can even check it at our own level by keeping a glucometer at home. We can check the fasting blood sugar also and the blood sugar after eating meals, that is the PP blood sugar. So adults with diabetes who do not have risk factors for type 2 may have a special test to see if they have type 1. Tests for the problem related to diabetes include an eye examination, blood and urine tests to check for kidney diseases, a food exam to check for nerve problems. How diagnosis is done? Your doctor will do a blood test. He or she will ask you to give a blood sample first thing in the morning before you eat. This is called fasting blood sugar. And if it results at least 126 milligram per deciliter, you may have diabetes. Your doctor will do a second test to make sure. So what is the expected duration? Diabetes it lasts for lifelong. It is lifelong disease. You cannot cure it by taking of medicine. You can only prevent it. You can take a symptomatic treatment only. How can it be prevented? It can be prevented by treating high blood pressure, cutting down high blood levels of cholesterol, lose excess of weight, and especially don't smoke. If you don't want to get diabetes, don't smoke. So the treatment, it may include the type 1 diabetes, it includes taking insulin, and type 2 diabetes, we can take anti-diabetic drugs. Thank you.